Okay, this is American Lung Association of Massachusetts, December 15th, 2008, Town of Freetown, Board of Selectmen, 3 North Main Street, Freetown. Dear board members, my name is Scott Keys, and I am the Public Policy Manager for the American Lung Association in Massachusetts. My purpose for contacting you is to present the board with summaries of several scientific studies detailing the health effects of coarse particles created by quarry operations and the impact of heavily trafficked roadways and diesel exhaust on health. While our organization has not conducted an extensive review of the project proposed by the Quarry Company, the American Lung Association believes that these health effects need to be brought forward for the board's consideration. Exposure to coarse particles created by quarry operations increases the risk of hospitalization for heart and lung disease, increases respiratory symptoms and decreases lung function, and may also contribute to premature death. Studies of respiratory and cardiovascular hospitalizations in Detroit and Seattle, and of respiratory symptoms among children in 6 U.S. cities reported significant health impacts from coarse particles at concentrations of 30 to 40 micrograms per cubic meter. The American Lung Association believes that controlling for coarse particulate matter exposure should be a top priority during operation, and that best practice for dust suppression must be implemented. The American Lung Association is also concerned about the health effects of diesel exhaust resulting from the additional vehicle traffic to service this project. Diesel exhaust is a mixture containing over 450 different components, including vapors and fine particles. Over 40 chemicals in diesel exhaust are considered toxic air contaminants. Exposure to this mixture may result in cancer, asthma episodes, and other health problems. In order to control for these health effects, the American Lung Association would strongly advise both the town and the Quarry Company to explore strategies to reduce diesel emissions. Such strategies could include, but not be limited to, using cleaner alternatives to diesel engines, retrofitting trucks with pollution reduction technology, implementing strategies to reduce truck traffic, restricting idling of both on-road and off-road diesel engines, and placing restrictions on facility operating hours and vehicle traffic routes. In closing, the American Lung Association believes that the board needs to give careful attention during the planning and siting of a quarry operation to the potential health impacts. Thank you for your consideration of our comments. If you have any further questions, please do not hesitate to contact me. And it gives the email address and the telephone number as well. Scott B. Keys, MPH, Public Policy Manager, American Lung Association in Massachusetts.